Do you sometimes have questions about your new and existing medications? Does it ever seem a bit overwhelming? Do you ever feel like you need more time for someone to go over your medications with you? If so, Womack Army Medical Center has clinical pharmacists who are medication experts that will sit down with you and assist you in understanding your prescriptions.
All right, Ms. Smith, your lab results came back and it shows that you have diabetes. I know you're already taking a lot of medications and this new diagnosis can be overwhelming. We have clinical pharmacists here if you're interested in seeing one.
Yes, I am.
They can go over your new medications and talk with you about how to manage your diabetes.
Okay. How do I make the appointment?
Scheduling your appointment is as easy as going to the front desk or calling this phone number here.
Thank you.
Good morning, Clinical Pharmacy. This is Ms. Davis. How may I help you?
Hi, this is Mrs. Smith. My doctor recommended that I meet with the clinical pharmacist. I was just diagnosed with diabetes. I'm already on a ton of medications, and now she started me on some new ones. I'm not really sure what I'm supposed to take or when I'm supposed to take them.
No problem. We can assist you with that. We have clinical pharmacists in all our primary care clinics that work hand in hand with your primary care provider to help manage your medications. The clinical pharmacist can meet with you for 30 or 60 minutes, depending on your needs. Since this is an initial appointment, Ms. Smith, we will recommend a 60-minute appointment. Which clinic are you assigned to?
I'm assigned to Clark Clinic.
How does Tuesday at 10 o'clock sound?
That'll be perfect. Where should I go and what am I supposed to bring?
You'll be seeing Dr. Womack, the clinical pharmacist who is located on Team 2. Please check in at the front desk. Bring all your medications to the appointment to include anything you're taking over the counter as well as your glucometer. During your appointment, the clinical pharmacist will go over each medication to screen for drug interactions and side effects. At the end of the appointment, you'll be provided with an updated medication list. You may want to make a list of questions or concerns that you want to discuss at your visit. Ms. Smith, do you have any questions?
No, I don't have any questions. So I'm going to bring my medication bottles and I'll bring my glucometer. This sounds like it's going to be very helpful. Thank you.
Yes, ma'am. Dr. Womack will see you on Tuesday at 10 o'clock. If you need to reschedule your appointment, please contact your clinic. Thank you and have a great day, Ms. Smith.
Hi, Ms. Smith. I'm Dr. Womack, one of the clinical pharmacists. It's nice to meet you.
Nice to meet you.
Your doctor referred you to me to discuss your new diagnosis of diabetes and to go over your new medications today.
Yes, I was diagnosed with diabetes last week and they've started me on insulin. I've went to the pharmacy to pick it up, but I've not started taking it yet. I'm not really sure that I even know how to use it. And honestly, I don't even know that I actually need it. You see, I've got all of these medications over here too, and I'm really just starting to feel overwhelmed. Like, I don't know what I'm supposed to take or how I'm supposed to take it.
Okay, well, I can definitely help you with that today. So what we'll do is we'll talk more about diabetes and we'll also go through all your medications together to help you feel more comfortable.
Okay.
Let's start out by going through how to use your new glucometer that you got and also how to use your insulin.
Okay.
Clinical pharmacists work with your PCM to manage your medications for the following conditions: asthma, COPD, diabetes, high blood pressure, and high cholesterol.
Thank you so much for going over that information with me today. You know, when I came in, I felt very confused and frustrated, but now that we've had a chance to talk, I feel like I have a much better understanding of all these medications and what's going on. Thank you very much.
My pleasure. I'm so glad you feel more comfortable. So what I'd like you to do is in 4 weeks, I'd like you to come back for a follow-up visit for about a 30-minute appointment. What we'll do then is I'll have you bring your new glucometer with you. You'll have your readings from since this visit, and we'll go through those together, and I'll answer any new questions that have come up since then. So you can schedule your appointment on your way out of clinic today at one of the front desks, and I'll see you in 4 weeks.
Okay.
Here's your medication list.
Thank you. And I'm going to go home and use my glucometer and take my insulin.
That's wonderful.
Clinical pharmacists can also provide the following services: battlefield acupuncture, medication review, quitting tobacco, medication device training, vaccination screening, and medication refill alignment. Contact the clinical pharmacy technician line to schedule an appointment: 910-643-2513, or ask your provider for a referral.